Shirin Yadager from LA Mom Magazine, and I'm here today with two Beverly Hills plastic surgeons from the Beverly Hills Plastic Surgery Group. I have Dr. John Layke and Dr. Payman Danielpour, and we're going to talk about Botox. Dr. Layke, I'm 36 years old. I really feel like I need the Botox. When I smile, I hate the frown lines here, and I think I'm ready. I'm a little fearful. What do you suggest I do, and how do I do it?
Well, my recommendation would be to start off slowly. So now most of our studies show that when you start Botox, even as early as your 20s, that you probably won't have wrinkles until your 40s or 50s.
Oh, wow.
What I would do is probably add just a few units on either side of the eye, just to allow to blunt the crow's feet. And then I would start in the central aspect of the forehead, and then it will even offer a little bit of a brow lift. So that would be my recommendation. You can always add more, you just can't take it away.
Right, and I don't want to look like I have it, so I have a lot of friends whose eyebrows are kind of stuck in the air. And how do you make sure that that doesn't happen?
Usually what we'll do is we'll add a small amount of Botox in the upper outer aspect of the forehead that really will soften the arch of the brow, and that tends to do the trick.
Great, thank you. So I won't look like Joker.
No.
All right, sounds
if
great.
done correctly, no.
Okay, thank you. So I have two questions for Dr. Danielpour. One is, if I'm still breastfeeding, is it safe to administer Botox?
Absolutely not. It's a very simple answer. There's no need to get Botox while you're breastfeeding.
Okay.
You can hold off, finish breastfeeding, and then come in for Botox. It's been shown that it's not safe to have Botox while breastfeeding. So.
Okay. And my second question is, I have a big event coming up, and I want to look perfect. So how far in advance do I come and see you before my event?
You know, there's a few different types of Botox. So there's the normal Botox that everyone hears about. Then there's also Dysport and Xeamine. The Dysport and Xeamine usually have a quicker onset of action. So 1 to 2 days versus Botox can take up to 5 to 7 days. We normally like to inject people, if they're going to an event, about a week before, so we know exactly what they look like, and if we need to do any touch-ups or what we call tweaking, we can do that in time for their big events.
Perfect. Thank you both for taking the time and for your expert advice, and please join us next time for more news on LAMomMagazine.com.